Overview of pharmacotherapy for tobacco cessation. Our learning objectives are that you'll be able to describe the rationale of pharmacotherapy for smoking cessation, list the first-line medications for tobacco cessation treatment, and explain the effectiveness of each medication. The rationale for using pharmacotherapy. Pharmacotherapy for smoking cessation will reduce the symptoms of nicotine withdrawal, making it easier for a smoker to stop using cigarettes. It's recommended that smokers who wish to quit be managed with a combination of behavioral therapy and pharmacotherapy. The combination produces higher quit rates than either behavioral therapy or pharmacotherapy alone. The first-line medications for tobacco cessation are nicotine replacement products, including the patch, the gum, the lozenge, Varenicline, or Chantix, and Bupropion, or Zyban. The choice of the first-line medication, with few exceptions, is generally based on patient preference after discussion with a clinician. The easiest way to think about and present the effectiveness of the different options for helping someone quit with pharmacotherapy are the likelihood of a person being able to successfully quit with any of these products. There are products that double a person's chance of quitting, and then there are products that triple the chance of quitting. So the odd ratio of close to 2 says that it's twice as likely for someone to quit using that product compared to doing not using the product, using no product at all. The confidence interval is the range of findings that are reported among studies. And the important thing to note is that a confidence interval doesn't cross 1. If it crosses 1, it means it's the same as the comparison. If it doesn't cross 1, then it's considered significant. So you can see that all of these odds ratios are significant because they don't cross 1, meaning the lower end and the higher end of the confidence interval don't have 1 in between them. The way you can present the different options that double your chance, so it's not exactly double, but for the purpose of discussion, I present it as about doubling your chances. The nicotine patch by itself, the nicotine gum by itself, or Bupropion, Zyban by itself, all will approximately double, working alone, your chance of quitting compared to not using them. There are 2 options for tripling your chance of quitting, and that both of these, you can see they don't cross 1, so these are significant results, and they're approaching 3 times, odds ratio of 3, so tripling your chances of quitting. This is a combination of nicotine replacement or Varenicline, Chantix. So a combination nicotine replacement includes a long-acting nicotine replacement. The only one is the patch. And then adding an as-needed nicotine replacement, such as the lozenge or the gum. So if somebody wears the patch and then takes the gum or the lozenge as needed, they will about triple their chance of quitting. If they use Chantix alone, they will also about triple their chance of quitting. And you can see that the most effective option we have is the Chantix. It has the highest odds ratio compared to placebo.